Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Professional Regulation Commission says there is no legal basis to allow non-nursing board passers to receive special work licenses, but is now working closely with the health department to address the shortage in nurses in government hospitals. PRC Commissioner Jose Cueto Jr. joins us in the program. And later, more calls to postpone the Barangay and Sangguniang Kabataan elections in Negros Oriental. But is this possible? Commission on Elections Chairperson George Garcia tells us more later in the show. The proposal of the Health Secretary Ted Herbosa to grant temporary licenses to nurses who did not pass the board exams has drawn mixed reactions. But the Professional Regulation Commission has made it clear that there is no law that will allow this practice. It is now working with the DOH to address the 4,500 nursing vacancies in government hospitals. They are also discussing the problem on the migration of nurses. Let's go straight to the source of the story. We have the Commissioner of the Professional Regulation Commission, Jose Cueto. Commissioner Cueto, it's good to meet you. Welcome to The Source. Thank you for your time.
Thank you very much, Pinky, and hopefully I'll be able to provide clarifications and explanations as far as the relevant laws are concerned.
Absolutely. We've actually been waiting for the response of the PRC regarding this proposal of Secretary Ted Herbosa, to which you've already addressed it, but we're going to dig deeper into this. First, sir, has there been any recent talks with Secretary Ted Herbosa?
We actually met last June 22, that's Thursday, and that's on the occasion of our 50th founding anniversary. So we had a short talk with him. Prior to that, we also had conversations with him, and I called him up after he was appointed as Secretary of Health. We were together at the UP College of Medicine and the PDH Department of Surgery and the Philippine College of Surgeons. So I know him very well.
Okay, so I think that, in the beginning, at the start of this, when Secretary Ted Herbosa was saying, I'm looking at possibly granting temporary licenses or giving, not him per se, but giving temporary licenses to those who passed who did not pass the nursing board exam but got a grade of 70 to 74. He said, I do recall, he said, I spoke to a commissioner of the PRC. I'm assuming that was you.
Yes, Pinky.
Okay, kayo po
that
yun.
was the day before.
Opo. So you had been talking with him about it because the question really was, obviously, who grants, number one, the license, and number two, is it allowed? And number three, is there such a thing as a temporary license? Please respond to that, Commissioner.
Actually, in the law governing the practice of nursing, Republic Act number 9173, in Section 31, there's a provision titled Practice through Special or Temporary Permit. These are limited to conferment of temporary permit to licensed nurses from foreign countries or foreign states. And there are three conditions. One is when they are invited as experts. Second is when they are hired by particular hospitals. And third will be humanitarian or medical missions. Outside of this, the law does not allow conferment of temporary permits. And plan maybe to give temporary permits to those who did not pass the licensure examinations for nurses does not have any legal basis. Now, I also mentioned that the only law, which is the Medical Act of 1959, that allows medical graduates to be given limited authorization by the Secretary of Health in times of national emergencies, is the only law which says that kind of provision.
I see.
There are no other professional regulatory laws that allow this kind of arrangement.
In other words, Commissioner, there's nothing in the law that will allow the issuance of temporary licenses to non-board passers. But you had mentioned this Medical Act of 1959. I'm not sure if it's 1959. Tama ho ba, Commissioner?
1959. Yeah.
Apo, 1959. That grants limited, tama ho ba, limited responsibility to non-board passers during times of crisis.
Yes, limited authorization from the Secretary of Health for medical graduates who have not yet taken or passed the physician license or examinations, but only during the time of national emergencies.
Right, but this will be granted by the DOH Secretary, not the PRC.
Yeah, it's specific that it will be the Secretary of Health, but usually granting of special or temporary permits to professionals is a mandate under the Professional Regulation Commission's authority. And as I said, it's an exception as far as the Medical Act of 1959 is concerned.
Pero parang ang tagal na po nung Medical Act of 1959.
One of the oldest regulatory laws.
Hindi ho ba?
Actually.
That's why what I'm thinking right now is there any other law that could supersede this Medical Act of 1959? Because all I know is that, well, number one, there's a Nursing Act of 2002. Hindi ho ba?
In the process, actually there are hearings being conducted to amend the Medical Act of 1959.
Yeah, I think they should be given importance as well. Okay, so that is clear. Now, if the DOH Secretary has the authority to issue temporary licenses, basically during times of crises, what would be an example? I guess I'll put it in context, sir. So many of our nurses are leaving the Philippines. They're migrating. The government has put a cap of 7,000. I think so far 4,000 have left half the year. There's 3,000 more. There's so many nurses that graduate every year, and yet there is a 4,500 vacancy in government hospitals for nurses. Could this be characterized as a crisis?
I don't think so, because I think best examples would have been the COVID pandemic, national emergencies like the typhoon in Yolanda in Tacloban, and if may go to a different topic, which is the statistics of the Professional Regulation Commission in the last 3 years, 2021, 2022, and 2023. We had 68,000 examinees with 47,000 passers. That's from 2021 to 2023. This May 2023, we had 10,764. So a total of 47,003 successful passers from 2021 to 2023 would far outnumber the stated shortage of 4,500 or even 5,000. So to me, a positive initiative of the DOLE under Secretary Laguesma and the PRC under our chairperson, Attorney Chat Zamora, is exploring how to tap these 47,000 passers. We have to know where they are, how can they be conducted, how can data about where they are needed, meaning in what regions, in what provinces or cities or municipalities are they needed now, so that we can have a strategy of maybe focusing more on those who passed, because we have more than enough. 47,000. So it's just a tracking system. We had talks already with the Department of Labor and Employment, Yusek Carmela Torres, and she mentioned to me about PhilJobNet, and this is DOLE internet-based job and applicant matching system. So I've scheduled a meeting on Thursday on that, because this would be, when I say more positive, meaning I don't think there will be any violent reactions to this, because we are dealing with passers of the nurse
Yeah.
licensure examination.
To which a number of senators already said, look for them, tap them. And it's good, Commissioner, you gave us the numbers, because 2021 to 2023, we have 47,000 passers. And the question really is, why is there still a vacancy? Sa dami-dami po nung pumasa. Just before we go on a break, Commissioner, how many exams are there in a year? Am I correct? Are there 2 exams per year?
Yeah, 2 exams.
Okay. One is
but
in
we
November.
were not able to administer the exam in 2020.
Right. Commissioner, I just need to take a break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, PRC Commissioner Jose Cueto. Just to be clear, Commissioner, your position is the same as the 2 other commissioners, one, of course, being the chairperson.
Yes, we agreed on that.
This is a unanimous decision. I want to talk about that concept paper. So that's between the PRC, you have the PRC, you have the DOH, and you have the DOLE. The question is, before we went on a break, sir, is that if there are 47,000 passers, I know you're saying that you need to look for them, nasan sila, saan yung mga vacancies, etc. But the question really is, I guess, how do you encourage them? Because if you ask the DOH, their entry-level salary is already at about 33, salary grade 15, 33 to about 35,000. And that's much more than those earning in the private hospitals. I guess the point is, Commissioner, alam naman po nila magkano yung sweldo. Bakit hindi pa rin napupunan? Why are there still vacancies? How do you encourage them to join government?
There are various factors to consider. Their own personal preferences, their own decisions, and of course, the only way that government hospitals will be able to entice them is, again, to emphasize that they will be serving our country. Because if we look at the statistics, even though the last 2021 DOH numbers showed that about 50% are migrant nurses out of the 600,000 PRC registry, showing the number of total number of nurses with active licenses. That means that there's still half of them who are staying in the country. However, there are nurses with an unspecified practice. There are nurses who may have gone into other occupations and not really covered by the scope of practice. And if you look at the nurses practicing in the health facilities in the Philippines during that time, for private facilities, there were 110,000. For public facilities, it was only 42,000. So we have a very small number of nurses working in public facilities. And that may be explained by the big number of private healthcare institutions. So enticing them will really require a comprehensive approach to the problem of shortage of nurses. Of course, as I said, traditional destinations like the US, the UK, Middle East, Australia, New Zealand, many people are saying that we are not able to compete, especially with the level of compensations that they give. And so what additional benefits will they get if they stay here in the Philippines?
So basically what you're saying is, because this is already the salary of the nurses is mandated by law, maybe let's put it at 33,000 for entry-level nurses for government hospitals. Basically, what you're saying is, you guys, the DOH, the PRC, and the DOLE have to think of ways to entice them, such as adding benefits, sir? Yun na lang ho ba yung nakikita nating possible enticement?
Yeah, for us, because we are implementing the continuing professional development and career progression specialization pathway, their career pathways is also very important. What will they attain, or what will they be after 10 years of practice? What will they be after 15 to 20 years of practice?
Okay.
Because I always illustrate this way, that graduates of the Philippine Military Academy, they have predictable career pathways, starting from lieutenant, for example, and then after several years, they go up. But we have to define this for healthcare professionals, municipal health officers, those who are working in district hospitals, and that includes all health professionals for that matter.
Commissioner, can you give me an example?
We are crafting our career pathways and progression.
I see. So that's one, career pathways and where they will end up going. Hindi yung may iwan lang sila sa isang ospital for a certain number of years and there's no career pathway, basically. That's one. Is there another benefit that could possibly be given to be able to entice them to work for government hospitals?
I'm not sure, but I think educational benefits for their children will also work, aside from working conditions, because many people are saying that those in government, especially the big medical centers, the nurses are overworked, and they are really dealing with a big number of patients in wards, in intensive care units, emergency rooms. So, as I said, we should have a comprehensive approach.
Okay.
And I would like to go back to the time that they are in nursing schools. And that's the reason why the discussion or the conversation should include the Commission on Higher Education, even the Civil Service Commission, the Association of Deans, the nursing schools, the Philippine Hospital Association, Private Hospitals Association of the Philippines, the Philippine Nurses, the FNU, and all relevant stakeholders, because they should be heard.
Yeah. Is there such a thing as an assistant nurse for these non-board passers with a score of 70 to 74%? Pwede ho ba sila maging assistant nurses?
My view on that, Pinky, is this. Those who are being recruited by foreign countries are the experienced ones. Those who have long tenure already in serving in critical areas like intensive care, emergency room, recovery room, operating room, and even the hiring of nursing assistants will not be able to replace them. Even the new graduates or the new passers of licensure examinations will take several years before they obtain or attain the mastery or expertise needed. So it's really a difficult problem. We may be thinking of alternative measures, but again, as I said, it's not a perfect solution, meaning hiring assistant nurses, because they will not be able to replace those who leave. Because a certain number of years of experience are required before you are recruited abroad.
But this is where that comes to play, sir. If 70 to 74%, those who got a grade of 70 to 74% are allowed to be, for example, sir, assistant nurses under the supervision of those board passers already, then they eventually, in a year, half a year, they take the board again, and then they pass, and then Secretary Ted Herbosa was saying they can stay here. May balik trabaho pwedeng 6 months, 1 year, depending on how long it took for you to pass the board. But isn't that also going to be good for them in terms of on-the-job training? But it's still, I didn't quite get a clear answer. Pwede ho ba yung assistant nurse for that segment, those that did not pass the board? Is that a possibility?
Part of the pronouncements actually of Secretary Herbosa is that they will be under supervision.
Correct.
From registered and licensed nurses. In that way, they can work as nursing assistants. Of course, the tasks will be defined. Definitely, there will be limitations, and they will be the responsibility of these senior nurses.
Okay.
So, on the way to taking or retaking the licensure examinations, that may be a good strategy.
Pwede po yun. Okay.
Yes.
So I'm sure there's still going to be a lot of talk regarding this. Commissioner Jose Cueto, thank you so much for your time.
Thank you very much, Pinky.
We'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned.